All right, welcome back. You're still watching the weekend edition of the Morning Express. I did tell you before the break that we're switching attention now to talk health matters. As captured in the papers for this morning, contrary to what we saw in the week, the strike that was declared by health workers, nurses, midwives, the papers had reported yesterday that the strike had been called off. And a reviewer did talk about the fact that the calling off of the strike was done by the health minister and not the people concerned. Speaking of the people concerned, we have them in the studio, and we're going to ask them why they have called the strike and if they haven't actually called off the strike. We'll hear from that. Joining me this morning, I have the honor of having the unit chairman and member of the State Executive Council, National Association of Nigerian Nurses and Midwives, Akwa Ibom State Council, Comrade and Onoitem David. Good morning to you. Welcome, Comrade.
Good morning, Akwa Ibom people. Good morning, Passion, and good morning, the Nigerian nurses. It's good to have you.
You're Passion as though we're on radio. Good morning, ADBN.
I've been so used to Passion, so yes. It's good to have you.
Yes, and we also have the Senate President, Akwa Ibom State College of Nursing Sciences, Senator Edidiong. Nkanang. You're welcome.
Thank you.
SB. So now, nurses. First off, the papers are saying you haven't called up the strike, contrary to reports that we had heard that the strikes have been, the strike being called off. Which one is true?
Anyway, thank you very much for that simple question. It has been a controversy for the last few hours after the meeting of the leadership of NAM at the national level with the minister at the federal government. I will want to say that I'm not here to talk as the state chairman of NAM. There are some questions that he will answer pertain to that, but I speak as the unit chairman, who is also a member of the State Executive Council of the National Association of Nigerian Nurses and Midwives here in Akwa Ibom State Council. Though we have a lot of information, I also as a nurse who is also manning some media platform to inform our colleagues about the updates on what is going on, not just the strike alone. Currently, the meeting was held as at yesterday from the information we've gathered so far, and the strike has not been called off. With the last memo that came from the national level, which we got it, and that was clearly stated, the Nigerian nurses strike can only be called off by the leadership of NAM at the national level. It cannot be called off by the government because it was initiated by the union leadership. So let me put it clear to the general public that the strike, the nurses strike, the ongoing nurses strike has not been called off by the union leadership. Today has been scheduled to have a meeting at the general emergency meeting. The NEC will have that meeting, and the outcome of that meeting will determine whether the strike will be called off or it will be continued. So far, so good. The brief statement is that the strike has not been called off.
So that's very clear. Let me come to you. Edidiong, why are you on strike?
Well, the strike is just as a way to make the government to bring the attention of the government to the concerns of the nurses and midwives in Nigeria. We have put out demands to the government, and over the years they haven't been met. So this strike is just to get their attention so that our demands will be met.
Okay, very short. Let me put it to you. Doctors have the Hippocratic Oath, which of course they should consider in some of issues like this. don't you have an oath that you would consider in embarking on a very sensitive strike as this? Because, of course, hospitals are the way they are, patients are groaning, we're probably losing lives. You do not have an oath that you should look forward to that should perhaps provide some kind of guard or, restraint?
Yeah, I've been a union leader for some years now, and we have been working in the states with all the unions that are affiliated to the NLC, which NAM is one of them, and I was actively involved. So today, by God's grace, we have new leadership, and I respect the new leadership very well. So sometimes if I speak on national issues like the current struggle, which is a nationwide strike, and it's affecting the nurses of Nigeria, which I'm one of them. Professionally, the nursing profession have just kind of a criteria, or what I would say the code of practice, code of conduct. And that is why before this strike was activated, it's not just a strike for some small demands. It's a strike that a lot of consideration has been put in place. And I want to tell the general public, and for you to also know, that this is the NAM, the National Association of Nigerian Nurses and Midwives, happen to be the only union in Nigeria that have not really think that strike is the best way. For the past 40 years, the Nigerian nurses and midwives have not gone to strike. 40 years. 40 years of lack of government sincerity in meeting the demands. 40 years of negotiation. 40 years of dialogue. And the Nigerian nurses have always been there to care for the patients. And after a lot of consideration, and that was before the notice of the strike came up, you will see in the letter, the Nigerian nurses, the leadership stated clearly to the general public that we understand the plight, what they might go through. And this is necessary because if a nurse that is caring for the patient in the hospital is safe, you can guarantee the safety of the patients. And as well, you can guarantee the safety of the general public. Now, by the time a nurse that is caring for the patient in the hospital is not safe in the area of the funding, the salary, the wages, in the area of you taking care of yourself, and taking care of others, and as well ensuring that you are okay. You know what it means, because the psychology of that nurse will actually sometimes will be affected negatively because it's not stable. And by the time the nurse that is caring for the patient, which you are there to provide the solution and to make the patient safe and go back and integrate himself or herself into the society and live a healthy life. By the time you're not safe, honestly, I don't think you'll be able to stabilize your mind to care for the others. But irrespective of this, because the profession have that code of practice, there's what we call compassion. And there's also what we call competency and commitment. So you always see that the nurse will always show that compassion and will always show that commitment and care for this patient, irrespective of what you are going through. It's just like you being a pastor. A pastor is going through a lot in the church. But because you are there, a lot of the congregation member is actually hoping on you. You are the one to pray for everybody. You are the one to care for them. So sometimes you abandon your own welfare to be able to take care of others. That is exactly what nurses are doing. All over the country, as I'm speaking to you now, even in the United Kingdom, currently the nurses are on strike because of wages. So if some of our colleagues that are even moving to the Jakba to abroad, maybe some of them working in the United Kingdom, in a month, a nurse over there is earning not less than sometimes 3 million, 4 million, 5 million
In a
naira.
month.
In a month.
Is that not an exaggeration?
So, and you will notice that if you are here as a nurse, you will see most nurses have to go astray to make sure that they keep themselves safe and for them to be happy.
If I may interject, you forgive me, please. Are you saying you are not well paid?
I wouldn't. You know, these demands is 9 points demand, 9 demands.
Can you run those demands
Yeah.
by us? Would like to know what those demands are.
One of the demands that has been placed before the federal government is gazetting of the nurses scheme of service approved by the National Council on Establishment in 2016 in Mina, Niger State. The number 2 is implementation of the National Industrial Court's judgment of January 27, 2012, suit number NIC/AB 3016/2020. The number 3, upward review of provisional allowance for nurses and midwives. Number 4, employment of nursing personnel and adequate provision of health facilities equipment. Number 5, creation of Department of Nursing in the Federal Ministry of Health. Number 6, inclusion of nurses in the headship of health policy making bodies. Number 7, fair representation of the UN Association on the board and membership in the Federal Health Institution. Number 8, centralization of internship posting for graduate nurses. Number 9, consultancy for nurses and midwives. And if you see those 9 points, it's not as if those things are things that can put much pressure on government. They are very simple things to do. In fact, most of them are not like demanding for money. Just put the system. Yeah, just put the system.
Money is not part of the
No, yeah, I would say like you say, yeah, one of them you see a review of this which has to do with money, but the rest of the demands are not something that will put financial pressure on the government. It's just a way of making the institution to stand firm, helping them to reform the health sector. With some of those demands, it can bring a lot of good reform in the health sector, and that is it. So you see those the year like 2016, 2012, 2020. You see that it's been long, and they have been negotiating. They have been negotiating, and they keep understanding. So at this time, the strike is not just the strike for maybe like the last circular they came out, a review of the allowances for the nurses. If you see what the review table, you even yourself, you will shed tears, and you will not allow any of your relation to go to nursing.
I do not intend to put you on the spot.
Okay.
If you say the nurses are poorly paid, can you give us an idea of how much a nurse earns?
I would say at the national level, like I said earlier, that there are some points that the state chairman of the association will have to handle.
I know.
Now, as a nurse,
how much a nurse earns that is poor.
Fantastic. As a nurse, generally, when you get to the school, you will spend a lot of money, and by the time you come out, you need to start somewhere, little maybe with private hospitals. And sometime in Akwa Ibom here, I started with 8,000 naira as a nurse.
That was when?
That was 2012. I started with 8,000, and I worked from 8 a.m. till 4 p.m. Now, because there was no other means, I needed to do it so that I can have the experience. That is how compassionate I am to the patients. I didn't even consider myself. I was considering going there to render the services. Now I'm going to the state. Now, once we enter the government service, and the government started us with, because the state government will not pay higher than what the national table, the table has to come from the national, just like the struggle ongoing now. So the struggle ongoing at the national level, sometimes they start them at that time. You see 70,000, 80,000, 90,000, 100,000, even with the time that the currency was really strong. Now, compared to the current economic situation, the currency is not really strong. I know the government is doing their best, but if you want to compare, you will know that the salary will not even be enough for the nurse to pay the
So let's give us a
transportation to the
range. Give us a
place.
range. So
Yeah,
the average nurse earns between 80 to 100,000.
sometimes it depends on the level. At this entry level, you might see maybe from 100 to maybe 100 to 150,000, 100 to 180,000, 100 to 100 and maybe 30,000. If you are a specialty, like yesterday, I was speaking with one of my colleagues in Lagos who is working in Lasut, and I asked how much are you collecting as the entry point. He said, yeah, it's a peri-operative nurse, which is a specialty, he added some things there on top, like allowance, call duty allowance. It was earning 169,000. And you have to pay transport to the place in a month. It was we just doing the budget in a month was about 89,000 naira. So, and I asked, are you paying house rent? He said, yes. So how are you managing with the house rent? He said, after working in government, he has to do some PPE, go to the private hospital to cover up so that he can make some earning, so he can cover up for the, the welfare. So you can imagine that. So compared to our own states, I must appreciate the current governor in our state, who is actually devoting much into health sector. He has a good agenda in the health sector. And I recall recently, even the current commissioner of health has emphasized that the welfare of health professionals will be prioritized. So I'm not really like doubting the state government here, because if you see the lofty agenda they are bringing on the table, like the international hospital, before those things will come and people will be needed to work, and you need people that have this skill and have been professional and licensed to work in that place. So I know that he's going to do something about it. So at this point, the demands have been placed at the national level. Once the demands have been maybe accepted, agreed upon, and implemented, it will step down. The leadership of the union will step down to the state level and negotiate with the state government.
Can I ask you said this struggle has been on for quite some time. You said 40 years.
Yeah, 40
the
years.
nurses have never gone on strike.
Yeah.
That's commendable. But before you decided to embark on this strike, I mean the nurses now, the health workers, was there a time you had put the government on notice? And if you did put the government on notice, what was the period of notice and what was the response from government?
Yeah, in the union matters, it has some protocol you need to follow before you embark on strike. We don't just embark on strike as people don't have, are not organized, or do not have a well guideline that back the organization. So you have to give the notice to the government, you keep going, keep notifying them, keep sending letters, talking to them, engaging with them, even on interview level, even when you're paying a costly visit, you still emphasize on it. So the leadership of the union have been doing that. But sometimes you do it because if you are a good son, to your parents, and you have not been disturbing your parent with money so much, your parent will always have so much confidence in you that anyhow that person will understand. But the child that always want to remove the father from the room to lie down on the parlor, in the sitting room, the father will always sometimes want to, can we do something for that one, so that he will not bring this problem or this grace to us.
Embarrassment?
But the other one will always understand. That is exactly what is happening. The nurses have been understanding with the government for over that 4 decades. And other unions actually have been going on strike, and you will not see us criticizing them. We know that this is their legitimate right, and they need this demand for, there's something why they are embarking on or demanding on this thing. Now, for us at the nursing provision, we have been engaging with the government, being good sons and daughters, and being good citizens of Nigeria, doing the job. In fact, if you go to some health facilities across the nation, you will not even like to send any of your relatives to the place. If you want to, you can go and check. You will not like to. But this is a place where a nurse will stay there and work. Sometimes they have to. I went to one hospital in one of the facility, one of the facility in the nation. Honestly, I was like, is this really happening in these states? Are you sure that this is a government-owned facility? That you have to use your phone touch, to say Canada. You have to. Oh my God. Even to a level that, oh my God, there are a lot of things you don't. You can't.
Are you saying that there are no facilities? The state of the hospital is not even anything to write home about. Is that what you're saying?
That is one of them. It's one of those things.
And it's contained in your demand.
Fantastic. Yeah.
To upgrade the
because
facilities.
By the time you, like with the demands, they said that you have to make the nurses one of the headship in the decision making. It's one of those things that will help the nurse, who is the one feeling the pains, who understands what is going on in the system of health at the facility level. This is what is lacking. And this is what we know that if you bring in, it can be of help. You know, it's just like you want to give contract to somebody to do a road, and you go and carry a lawyer to give a contract to do engineering work. Do you think you can have a good job? A lawyer has been specialized to do the legal work. So I respect the engineer to come and do that job because it's an engineering job. He knows, he has been taught, he knows everything. So the same thing with here in the health sector. If you bring in a nurse in the decision-making table, when it has to do with health, you know that the nurse is the one that is in the facility. You understand what you can bring to the table. If you want to build something now, you say, okay, please, can you put the nursing station here? He knows why he says you should put the nursing station here. This is part of the contribution. And at the leadership level, sometimes anything that will bring a reform, and you're not bringing a nurse into the leadership decision-making table, and you are going there to discuss something that concerns the nurses on that table, who will be the one to tell you exactly what?
So are you saying that decisions pertaining to the hospitals before now, the nurses have not been carried along? So decisions are just made, and the nurses are just made to work there.
And sometimes it's very hard for you to. It's very hard for some of the settings to bring in the nursing at the leadership affairs, the decision-making level. And sometimes, if they manage to even get to that place, you give a contribution, and sometimes it's not taken because the system has been organized in such a way that sometimes it doesn't recognize these people. Currently, let me say, currently at the nursing council level, there are students that have graduated from school, and they have been waiting for their certificate. And the certificate has not come. 2 years, 3 years. I know of somebody that has graduated 2023 and the certificate has not arrived. Why? Because the chairman of the board has not been set up. And the registrar of the nursing council cannot just sign the results alone, the certificate alone. It has to be signed, and the chairman of the board has to be signed. And that board will also have the representation of the union. So now the board has not been set up. Now you see the impact now. Now currently the Akwa Ibom State government is employing, has launched an employment portal for the nurses and other health and other workers. Yes. Now, if you don't have this certificate to put on that portal, would you be qualified to be hired? No. And at the health sector, we need more personnel. So you see the impact of this thing. Like the last time we talked about closure of portal. Now, the closure of portal, I know of thousands of nurses that were affected. Thousands. I'm not just saying a nurse. I said thousands that were affected. Not some of them did not even jackpot to go and work there. Some of them only left to go for academic advancement. Only for the closure to frustrate the thousand that return back to this country and start -1, not even -10 or 100. So you see the impact. And I must appreciate the general public. I've never seen the kind of sympathy, the support the general public have given, the way they are giving to the nurses this time. when you talk to them, you get the you filter.
You are appreciating the public for sympathizing with the nurses and for understanding, but are you considerate of the many patients who might die in the hospital for lack of, health care? You're on strike. Patients are in the hospital. You're appreciating Nigerians, you're appreciating the public for the sympathy, the support.
Yeah.
But what about the patients?
You're right. I must say this. You are the owner of, we as the professional, our first care is to the patient. But you cannot go to a facility and work because it's not your facilities. Am I right?
Are you being shut out from working?
No, you are not going to your facility because it's not your facility.
Yes.
These facilities are being owned by who? Government. Am I right?
Yes.
Now, and the government, the responsibility of government is what? Is for the people. Am I right?
Yes.
And to make sure that the people are safe and the properties are also safe, providing a conducive environment. Am I right?
Mm-hmm.
Now, with all this, it means that the government owns these hospitals and they hire the personnel to work for them so that they can provide what the Constitution has given. Like, this is the responsibility of government in making sure that the governance is for to the people. And part one of the agenda the government will present during the campaign will be what? Sometimes it will even capture health, because they understand the importance of health in governance. Because if you don't have a healthy society, honestly, that society can never you can never see any development. So it's an obligation of the government to make sure that they make the health care affordable, accessible. And
I asked the question.
Yeah, so that pertaining to that.
The question I asked is, you're on strike.
Okay.
Patients are suffering and may die in the hospital. While you thank Nigerians for your understanding, for the understanding they show the nurses, are you also considerate of the patients that might die from lack of care in the hospitals?
Yeah, that is the area I was driving to. So after this, to show that we have that compassion, that so much passion for the patient to care for them.
Yeah.
For that is why for the past 40 years, no strike.
Yeah, but in the past few days, you've not been taking care of patients.
So it means that the owners of the facilities do not care for the patient.
No, this is not the owner of the facility. This is you working there now.
That's what I'm saying.
The patients are not taken care of as we speak. In the past few days, nurses are on strike. And if they do not receive the proper care, you do not expect the doctors to be the one running all over the place.
That means that's what I'm saying. That means the constitutional obligation of the government has failed, because you have been oblique. You are now take an oath that you are going to provide this basic health care for the people. And part of those things is for you to make sure that the staff there, the staff that are working to care for these people, have been taken care of. So you are not taking care of them. Where are you going to hire people?
You have not answered my question.
So
would you be happy, nurses? Okay. Would you be happy if, as a result of your strike, currently ongoing, that we have casualty, that we have patients dying in several hospitals all over the country? Would you be happy?
Oh, no. You don't expect us to be happy, because our professional code of practice does not even, it doesn't even capture anything you see in a patient suffering.
So don't you think, while expressing your demand, you can partially be working?
No,
so
that is why
we don't have people die.
That is why, because of the compassion of the organization and the profession, you see, the strike is not an indefinite strike. It's just a warning strike.
How long is this warning
strike?
Just
a 1 week. 1 week.
How many days have you done?
We started the strike, that was on the 29. 29, yes, 29 of years. So it's just barely how many. And other healthcare workers are actually doing their best, but even doing their best, they can't cover the gap that the nurses would have. In any healthcare sector, the nurses are the highest people, because they are the one always staying with the patient. So I want to use this opportunity to urge the government to sympathize with the general public, because it is their obligation, oblique right, constitutional obligation for them to care for the people, to provide the basic healthcare services for the people, and to make sure the people in the society are safe by ensuring that they meet these demands as soon as possible. They listen to this and they cry. In fact, let me take you to, in fact, because of this 40 years gap of not going to strike, a songwriter by name Ako YS came out with a song and dedicated to the nurses of Nigeria and said, "Antak, healing hands in pains, healing hands in pain." And in that healing hands in pain, he now said, dedicated this song to all Nigerian nurses. And in verse 1, he said, "We rise with the sun, our shifts never done, tending to the sick, our hearts never numb, but the weight of our work, it takes its toll, long hours, low pay, our soul grow old." And in chorus, he said, "Healing hands in pain, we cry out for aid, overwork, underpaid, our futures at stake. Government, hear our plea, intervene now, we beg."
You're reading the lyrics of a song.
Yeah.
And there's something you said, which for me is very fundamental to this conversation.
Okay.
Overworked.
Yeah.
Underpaid.
Fantastic.
And nurses overworked.
Oh, that one is an understatement. It's an understatement. You know that by the World Health Organization standard, sometimes I will say, the nurses in Nigeria, that is why many countries always come to look for the nurses of Nigeria to come and work for them. Because by the standard, it's 37.5 hours per week.
What is the explanation of 37.5 hours a week?
Now,
that translates to how many hours a day?
That translates, in a day, you need to work like 8 hours.
8 hours?
Yes.
From what time to what time? You work shifts, yeah?
8, yeah.
So morning shifts,
morning 8 mean more 8 a.m. to 2.
8 a.m. Is that not too late? You're supposed to resume early. You have patients who have
No. You resume. When I say 8 a.m., the 8 a.m. is the work starts. Already people are down. In the process of doing the handing over, because you need to take over from the next shift.
Okay.
And handing over is a process that you need to take it so serious, because this has to do with documentation and understanding what happened in the former shift.
Okay.
But it's just during the handing over, it's only one person that will come to discuss with the new team. So others will still be on the ward intact to take care of those patients. So it's still a process. Now, in the normal standard, like in abroad, it's 37.5 hours. Meaning that if you want to work sometime, maybe 12 hours, it's just 3 days in a week.
3 days in a week?
Yeah. If some people that want to work like 12 hourly in a day. Good. Now, but coming back to Nigeria, you see a nurse work from, let's say, the 8 a.m. was the normal standard. You know, in Nigeria, we have to, because we show compassion to the patient. You see a nurse who go to work from 7:30 a.m., start work, and will come back sometimes 4 p.m., 5 p.m., 6 p.m. I know of a nurse that used to come back home 6 p.m. And the last time I met that same nurse, you see, it's not healthy. Have you been eating? No, it doesn't have time to eat. Even the children at home, it doesn't have people that care for them. Because a nurse is a nurse. Yes, you have been taking that hood to work as a professional, but you also have a responsibility to take care of your home, because if anything affects your home, it affects.
Can I ask you a question?
Your psyche also.
This warning strike, as you call it, is a 7-day warning strike, right?
Okay.
Now, if after 7 days there is no favorable response, I'm just saying, what next?
The leadership of the union has met with the federal government as of yesterday, and today has been scheduled for an emergency NEC meeting. So by the end of the meeting, they will decide and they will communicate to us. So I'm not in a position to tell you what will happen for now. So until after the meeting, then we'll know the next update. Just like you asked me at the initial level about whether the strike has been called off. In fact, there was a memo from the National Deputy General Secretary dated as at 1st August. He said, communicating to the public and also to the nurses of Nigeria, that following the outcome of the negotiation meeting held today, that was first, with the Honorable Minister of Health and Social Welfare, that's and the Labor. And they also said that the strike has not been called off until after the until after the meeting, the emergency meeting today. So by the time the meeting, they finish with the meeting, I think we can talk more about it. That
Okay.
actually, yes, this is what will happen.
Okay,
But for now,
let me hold you for a bit there. As we look to conclude this conversation, Edidiong, let me ask you, what message do you have, to the government as a result of this ongoing strike? Because I know it's also affecting the students in the school. For a moment, can you tell us how it's affecting the students in the school and what message you have for the government?
Meant to please give in to the demand and listen to our cries, because this thing has been going on for so long and it's really affecting the students in that we had our finalists, they're writing their pre-council exam, there's pre-qualification exams, but because of the strike they could not conclude their examination because the nurses are also our lecturers and they can't come to work because obviously they are observing the strike. And the portal is not us that controls it. So we have to follow the portal bit by bit, and this strike will, if it continues, we pray it doesn't, will affect the finalists and every other student. So please, and also in the long run, it affects the students because even when we go for clinicals, we don't have enough facilities to learn what we are supposed to learn when we go to the hospital. So with all that being said, we just beg the government to please listen to the nurses. This is actually hearts. How do I put it? It's from the bottom of our heart. We do not like the fact that in fact we are not comfortable because nurses are compassionate, right? So yeah, that's what we have to say.
Okay, as we conclude, let me ask you, Comrade, you are talking to Nigerians and by extension the government. What would be your message to the government now? And by extension, Nigerians.
Fantastic. Okay. Please let me reshape the answer this way. Let me say the message to the nurses, the message to the government, and to the general public. The message to the nurses of Nigeria is number one, the federal government, that's the INEC, will launch the new voters registration, continuous voters registration from, I think, this August. The nurses of Nigeria, I will say, please, if you did not do your voters card, make sure that you ensure to have it. Once they comment, go and register for your voters card and have that voters card, because it's one of your power. Deciding for a leader that will govern us is very important. When you check the agenda and you know the agenda, what they have will affect us positively, you know that you need to vote the person. So you decide. And because the governance, what we decide today will affect all of us tomorrow.
Okay.
Now,
You've done something else, but maybe after the show, I'll ask you to pay me for that. No problem.
Then second, to the government. Okay, before I conclude, into the government, I will also urge the nurses of Nigeria to keep in faith. We believe that the government will respond to their demands. And don't also forget to pray for your leaders. Work with them, support them while waiting for the outcome of the meeting today. Then to the government, the wordings of that songs already stated everything that I would have said. Please, the government, we know that you have done your bit, but the nurses of Nigeria have been ignored for some time because we have shown so much understanding for over 40 years. Please, the government, they have a listening here. Please analyze, dissect this demand, and we believe that you just by dissecting and understanding the importance of making sure that the nurse is safe, and that will transfer to the safety of the patient and as well the safety of the general public. Try as much as possible to meet these demands. Where the era of coming to talk and drag and shout is over. Nurses are now so much intellectual, and they know the way they are handling issues with brain and not too much of shouting. You see, in the last few years, a lot of nurses don't talk. They don't talk much. If you see that nurse today, tomorrow you hear the nurse is in the UK or is in the US.
Okay.
So then to the general public,
you are invariably trying to tell us that we should expect that you japa as well.
No. We are here. We are here to care for the people.
So you're not japaring?
No, we are not japaring. So
that
is why we say the government should take care of us.
Your demands.
Just look into the demand. Then to the general public, thank you so much for understanding. Thank you for your support to the nurses of Nigeria. We understand what you are going through. And we believe that the government will actually meet this demand so that the nurses of Nigeria will return to the facility to work.
I must thank you, the unit chairman, member of the State Executive Council, National Association of Nigerian Nurses and Midwives of Akwa Ibom State Council. Thank you again. That is Comrade Onoitem David. And I must thank you also, Senator Edidiong Nkanang. Did I get that? Senate President of Akwa Ibom State College of Nursing. Thank you so much, gentlemen, for coming. Thank you.
Thank you very much.
We do hope that you call off the strike perhaps today.
The outcome of the meeting will determine.
Thank you. Thank you.